Yep.
Good afternoon, everyone. Thank you for joining us here today. Please be seated. Welcome all. My name's Fernanda Lopes, and I serve as the Chief of the Office of Health Systems Development at the Rhode Island Department of Health. We're now going to have a brief announcement in Spanish to let people know that we have interpretation services available. A member of our staff is available to translate in the event a Spanish-speaking member of the public would prefer translation services to make a comment. Margarita.
Buenas tardes, mi nombre es Margarita Jaramillo, trabajo con el Departamento de Salud de Rhode Island y estoy acá para servir de intérprete en caso de que alguien desee hacer su aporte en español. Good afternoon, my name is Margarita Jaramillo. I work for the Rhode Island Department of Health, and I'm here to be as an interpreter in case somebody preferred to do your comments in Spanish.
Thank you, Margarita. So safety first, please note the exits are located on either side in case of an emergency. And turning over to the slides to review the purpose and some important reminders pertaining to our joint public meetings. So the Rhode Island Department of Health and the Attorney General's Office are hosting jointly two hybrid public meetings regarding the hospital conversions application of Centurion's proposed acquisition of Roger Williams and Our Lady of Fatima hospitals. These meetings are being held today, March 19th, 2024, and March 26th, 2024, from 4 to 6 p.m. The Centurion Foundation, Inc. submitted a Hospital Conversions Act application on November 14th, 2023, to acquire the Charter Care Hospital System, including Roger Williams Medical Center and Our Lady of Fatima Hospital. The Rhode Island Attorney General and the Rhode Island Department of Health are currently reviewing this application, which has now been made publicly available. This meeting is to hear public comments on the application, which will be used by each agency to inform our ongoing review. So the agencies will not answer questions or offer comments on the application at this time. To review some important reminders, please sign up to speak using either the electronic sign-up form or paper sign-up sheets for those in person. Names will be called in the order that you signed up. This meeting also has card captioning. Please speak clearly and slowly into your microphone to allow the captioner to capture your comment. To turn on captions, please use the link provided. One speaker will be called at a time. If you are joining virtually, we will unmute you. If you are in person, please approach either of the two microphones that are here. Each speaker will be allotted 3 minutes to allow as many people to offer comment as possible. All are encouraged to submit written public comments if you have additional comments that you wish to share. The Teams chat will be disabled during the meeting. If you would like to submit a written comment, you may email that comment to healthcare@riag.ri.gov and or fernanda.lopes@health.ri.gov until March 29th, 2024. And of course, the last bullet goes without saying, but please wait your turn and be respectful of other attendees during this meeting. Thank you. At this time, I'd like to introduce Attorney General Neronha to offer some comments.
Good afternoon, everybody. It's good to see you all. It's good to see this much interest in an important proposed transaction. Just want to welcome you all. Want to thank the Department of Health for your partnership in this and so many other matters. Introduce Jordan Broadbent to the outside and Julia Harvey closer to me, who are two of our four-member healthcare team. It grows ever larger because healthcare becomes more of our mission seemingly every day. So looking forward to hearing the public comments tonight, next time, and thank you so much for coming out. Sandra, do I introduce you? So Sandra Powell. And off of the time.
Good afternoon, everyone. My name is Sandra Powell, and I'm one of the deputy directors at the Rhode Island Department of Health. As the Attorney General said, we work in partnership with the AG's team for the review of these types of applications. So I'm going to just say a few words about this application and how we are all looking at it according to the law. So with me, as I'm here on behalf of our acting director, Dr. Bandy, who isn't able to be here today. And I also have a few of the staff members from the Department of Health. At the very, very far right is Julia Wyman, who's our acting executive counsel. Next to her is Alana Philippi. No, Alana's going to kill me. Alana
Campbell.
Yes, that Alana Campbell, who is also with the department and does monitoring. Fernanda Lopes, who you just met, who's the chief of our Office of Health Systems Development, and Mike Dexter, who leads our Center for Health Systems Policy and Regulation, under which this work sits. And we have other staff members here in the audience and also other consultants who are working to really thoroughly review this application, the very important application. So we're here to do really the important work of listening to your comments. That's what this is all about. We're all on the same page in that. And we know that for this application, the application concerns the acquisition of Roger Williams Medical Center and Our Lady of Fatima through something called the Charter Care Health of Rhode Island Incorporated. And that means it will acquire the Charter Care hospital system, including both hospitals, and the estimated cost of the transaction, according to the application we have, is about $193 million. And that is, as proposed, will be financed by Charter Care Health of Rhode Island, which is the local entity that will own the two hospitals. So as you may know, that the health department is responsible for licensing healthcare facilities, including hospitals, so that's part of our role. And we want to make sure that when we look at a proposed transaction like this one, we're thinking about several things. So one of them is the future sustainability of the healthcare systems. We have to think about that. We have to think about the long-term impact on healthcare, on quality, safety, and access. And that's important to every transaction we do because we work closely with the AG and his team, and we have a very long and broad interest in the healthcare system and its ongoing sustainability. So there are many criteria that we look at. I won't go through all of them. You'll hear about more of them. When we review such an application, we follow the law, of course, and we look at issues like character, commitment, competence, standing in the community of the entity that's looking to acquire a hospital or a hospital system. We want to make sure that there's access for people that's maintained. And also we want to make sure that traditionally underserved populations are also able to access services. So we're looking at the big picture and the long picture in this. The Hospital Conversion Act requires all of us to work together to protect the public's health and welfare and to ensure the viability of the healthcare system. And we're really looking forward to hearing your thoughts and comments and working very closely with our colleagues at the Attorney General's office. So thank you very much. And with that, I'm going to turn it back to Fernanda.
Thank you. Again, welcome. I'd like to review the framework around the administrative and procedural processes that will be undertaken in today's meeting. First, I'd like to note that this meeting is being recorded and will be posted on both the Attorney General and the Rhode Island Department of Health's websites. We also have with us partner interpreting for CART services. So we hope to establish an audio recording and a transcript of this meeting for the record. As this public meeting is being held as a hybrid meeting, we have a large number in attendance today, both remotely and in person. In order for it to be conducted in an organized and orderly manner, I'm requesting that those participating virtually please remain on mute until it is your turn to provide comments. Muting will help avoid any feedback and allow us all to hear others speaking one at a time. I really appreciate your flexibility in this hybrid environment. As the link posted in the public notice to sign up for the joint public meeting is a live link, if you haven't already done so and are interested in providing comments during today's meeting, please sign up. For those of you in person, RIDOH staff are by the entrance ready to assist you. Participants will be called on to provide their public comments according to that active list. It's important that the person speaking during the course of today's meeting identify themselves by name, affiliation, if any, and please spell it for us so the record is clear. Please refrain from posting reactions or engaging in chats. Each participant in this meeting will have up to 3 minutes to speak. I ask that comments provided by those speaking today please be pointed, succinct, and concise so that we have an opportunity to hear from all who have public comments to share. If you have already submitted written comments, please be advised that those are part of the record and do not need to be repeated here today. Written comments will continue to be accepted by both agencies through March 29th, 2024, in place of or should you want to supplement your verbal comments here today. We're here to listen to public comments regarding the hospital conversions application that is currently under review by both agencies. That is the Centurion Foundation, Inc.'s proposed acquisition of Roger Williams and Our Lady of Fatima hospitals. Again, all verbal and written comments regarding the application will be considered by both agencies. We want to be able to hear from you, members of the community. Aside from our introductions, the representatives from the two agencies will not be speaking in response to any specific comments. However, we're here to hear and record your comments. Finally, if there are any reporters here with questions, please bring those to RIDOH's Public Information Officer, Joseph Wendelkin. With all of that said, I will call upon Attorney Rocha to introduce applicant representatives for some brief comments and an overview of the proposed transaction. Thank you.
Thank you, Ms. Lopes, Ms. Powell, and the RIDOH team, the Attorney General team. Good afternoon, and thank you for scheduling this public meeting. With Richard Beretta, we represent the transacting parties in the proposed transaction with the Centurion Foundation to be the new owner-operator of Roger Williams Medical Center and Our Lady of Fatima. With your approval, these two community hospitals will be returned to nonprofit status under the local leadership of Jeffrey Liebman and his management team, and an independent local board. Most importantly, it will be under the leadership and sponsorship of Centurion, whose mission is to equip nonprofits with financial and technical resources to fulfill their missions. Here, this transaction will ensure that the hospitals continue to provide access to the communities they serve of high quality, needed, and affordable health care. We believe the transacting parties meet all the statutory review criteria. We look forward to continued review and ultimately approval of the Hospital Conversions Act application. At this time, I'd like to introduce Jeff Liebman, the President and CEO of Prospect Charter Care, who will be followed by Ben Mingle, the President of the Centurion Foundation. And with your approval, may we use the podium?
Thank you, Pat. My name is Jeff Liebman. I'm the president and CEO of Prospect Charter Care, who currently owns both hospitals, Roger Williams and Our Lady of Fatima. These are located in Providence and the North Providence communities. Let me spend a few minutes describing just some of the important services, by all means, not all the services that we have the privilege of providing. The first is in cancer care. I think everyone knows us as the cancer hospital in the region. We provide very high-level services in medical, surgical, oncology, in BMT, and radiation therapy. We also provide extremely high-level services in elder care with the only gerontology fellowship in the state. We have a busy, growing gastroenterology service that we continue to add to. In terms of mental health services, we are the largest inpatient program for any acute care hospital in the region, with over 100 licensed beds for behavioral health patients. We are also an academic medical center training program through our affiliation with Boston University School of Medicine, which is a primary feeder for primary care doctors who train here and stay in this state. Our services to the community involve also other very, very important features. Our emergency room at Roger Williams, which is the newest emergency room in the state, built recently, where we spent over $15 million, has about 30,000 emergency room visits a year, 7,000 inpatient admissions. Our Lady of Fatima emergency room has almost 24,000 emergency room visits and about 6,000 admissions. As you know, Prospect made a decision to exit the state. With that, there was a robust process on request for proposal to find people who are interested in helping us. Only one viable candidate came forward, which is Centurion, to ensure that our mission would stay in place on a going forward basis. Not only was this the only viable candidate, but it was also one that had a great solution. This solution is good for our patients, it's good for our community, it's good for the state, and it's good for our employees. Over the past 2 years, we've worked very closely with Ben Mingle, Centurion's president and CEO. We'll be hearing from him in a few minutes. And under his leadership, we will be returning to local control, local governance, not-for-profit status, and an ability to use a platform to continue to grow and be even better at our service.
Thank you, Jeff. Thanks, everybody. Good afternoon. My name is Ben Mingle. I'm the president of the Centurion Foundation. I lead all of our mission expansion activities. Centurion Foundation is a very unique organization. We were founded as a charity in 1996. Our mission is to equip other nonprofits with the financial and technical resources for their charities to succeed. Centurion's mission of assisting these other not-for-profits includes a wide range of activity that goes from owning the building, leasing the building.
Is that correct?
Yeah.
No.
Please
No,
continue.
Go ahead. Please continue.
It includes a wide range of owning the building, leasing the building in a number of different manners. Centurion is solely focused on healthcare. Our mission today is only about changing the healthcare dynamics in this country. Centurion works closely with all of our clients and collaborating together. To date, Centurion has assisted 13 different not-for-profit health systems across the country in 25 different transactions for 36 facilities. Those facilities total $1 billion in total financings, and we have 1 million patient encounters a year across these facilities. So we are very intimately familiar with touching the patient life. Centurion's clients include people like Ascension, organizations like Ascension, Common Spirit Health, Boston Medical Center, Multicare, and Infirmary Health System, to name a few. Centurion is currently delivering annual savings to its clients in excess of $30 million a year. As you heard from Jeff, we responded to the RFP. We Centurion did, and as our understanding, we were the only proposal that met the requirements, kept these hospitals open and operating and independent, providing high quality care to the community and the patient. Centurion is an expert in healthcare finance and corporate governance, and with the regulator's approval, we will own and operate the hospitals with Jeff and his management team running facilities. Our proposal will return local control and independence to the existing management team under Mr. Levin, and under his leadership, the local board govern these organizations to make sure they're meeting the needs of this community. There won't be any outside influence changing what's happening here. Centurion has worked closely with Jeff over the last 2 years, and we're excited. He and his management team have all agreed to stay on with Centurion. Centurion is confident in the ability of our management team to convert these hospitals into self-sustaining organizations, which is critical to their long-term success. We will have a local board that is responsible for empowering and governing Mr. Liebman and his management team to ensure that its mission, Charter Care's mission, is delivered. Centurion's proposal will also ensure that any excess revenues of these facilities are reinvested back in the communities, to increase charity care, to increase capital investment, to increase benefits to all the employees. Centurion's proposal provides that day one, there will be an $80 million backstop in capital reserves to fund these hospitals and serve as its backbone of financial wherewithal, which is in line with all other not-for-profit hospitals in the country, not just Rhode Island. I want to spend just a minute and recognize the issues raised by the union. We understand their current position, and we are confident we will continue to work together with the union to ensure the viability of the two hospitals here. To be clear, we've agreed to assume the existing contracts and will work with the union to ensure fair market and competitive compensation for the entire team. Our model will also return jobs to Rhode Island that are currently in other states and other countries. In closing, Centurion is committed to empowering our local leadership team to implement and execute the hospital's mission of delivering healthcare to the communities it serves. Centurion is going to leverage both our intellectual and financial resources to ensure the hospitals have access to capital that they desperately need to succeed in the future. This is and has always been our guiding principle as an organization for the last 30 years that we've been in existence. And with the approval of the Attorney General and the Department of Health, we look forward to being a leader in the Rhode Island healthcare community. Lastly, I would like to thank the Attorney General and the Department of Health for scheduling the meeting today and their time in reviewing this process. With your approval, we look forward to serving Rhode Island. Thank you.
Thank you. I'd like to call upon Sarah Konechnik, please.
My name is Sarah Konechnik. I'm the Patient Experience Officer at Rhode Medical Center, and Our Lady of Fatima Hospital. If you're not familiar with the term patient experience, it entails all interactions shaped by an organization's culture that influences patient perceptions across the continuum of care. In other words, I have a really good pulse on patients' feedback, what they liked, what they disliked, as from the time they walk through the doors to the time that they get discharged. And I make it a priority to follow up with as many patients as possible who take the time to share their feedback, because I want to ensure that our community feels heard, especially when they're going out of their way to complete a survey, leave an online review, or reach out to me personally. In turn, I feel pretty familiar with our organization's strengths and weaknesses. Our number one strength is without a doubt the staff. It'd be close to impossible to do my job without a team equally as driven to meet patient needs. And from previous work experience, I see how much better that strength becomes with localized leadership and opportunities provided to nonprofits. It's without a doubt enhancing the patient experience. I'll wrap this up with some comments left on a real-life survey from Roger Williams Medical Center. This patient, Anna, could not make it this evening, but graciously allowed me to share her words from her satisfaction survey last month. Anna states, "My first contact person in the ER was very kind and acted fast to my needs, which I clearly needed. The nurses accommodated my request kindly and efficiently. The lady that cleaned my room in the morning was lovely, kind, and professional, and asked if I needed anything. She was so sweet. It certainly made my day. All the resident doctors were amazing and very informative and caring. The care I was given during my stay in CCU was amazing. I cannot say enough about the team working there. The care given to other patients was A+. Yes, I wish I was never in the CCU, but I felt safe and cared for while I was there, and I'm thankful to every single person that helped me get better. Thank you."
Thank you. Frank Castellone.
Thank you. Good afternoon. My name is Frank Castellone. I'm the Director of Safety, Security, and Emergency Management for Charter Care Health Partners. Prior to that, I worked for the State Police here in Rhode Island for 25 years. I retired in 2014 as the Executive Officer for the Department of Public Safety and was fortunate enough to come to Charter Care to work. I can tell you from my professional experience that the leadership here at Charter Care is some of the best that I've ever worked with. I don't take that lightly by saying that, but that is the truth. I'm here in support of the application for the Centurion Foundation, excuse me, for the sale of Charter Care to the Centurion Foundation. Over the past 10 years, I've experienced some amazing and inspiring work done by our employees in our hospitals, in our two busy emergency departments. So much so that I brought my own family to be treated at both hospitals. As we are all aware, healthcare workers work in a very tumultuous and challenging environment. And I have witnessed the best of people during these times. I know we're at the crossroads really right now here at Charter Care. And I'd just like to say that we really need the stability of this application to go through. I have faith in the Centurion Foundation. I believe this is the best opportunity for Charter Care to move forward. And I thank you for your time.
Thank you. Dan Isa, please.
Used to dread these meetings when I was in the legislature. The mind can only absorb what the bottom can endure. So I'm going to be extremely brief. I've been working in the healthcare field for about 40 years, radiology, home care, and just the last 3 part-time for Charter Care. The hospitals were always the enemy because we were an independent testing facility. And I can't tell you what a wonderful experience it's been working with the management team there. I call on the physicians, on all the other providers, by the way, on behalf of Charter Care, listen to if there's a problem, a question, an issue, or I try and clear it up. And the management has been unbelievably responsive to any problems I bring forth. They're very professional. I'm thoroughly impressed. Frankly, if I'd have known they were that good, I'd have started with the hospitals earlier in my career. There's an old saying, if you're a good facility, the doctor sends his patients to you. I brought my mother to them. So the response to that is, if you're great, the doctors send their mothers to you as well. I can't tell you the quality of the staff. I've never not encountered one rude or one short provider, be it a nurse. They give 100%. It really is impressive. The nurses, the NPs, the PAs, the staff, the reputation is fantastic. I was in the legislature when they allowed for-profit hospitals, and if this application is allowed, and I hope it is, there will be no more for-profit hospitals. I don't think it's worked. Be it the reimbursements or whatever, there is no more money in medical. I am so pleased and appreciative that Centurion has come forward, and I would ask you to consider approving the application. And I absolutely think if we don't, it'll be a disservice to the people of the state. A lot of people don't have transportation. These facilities are centrally located. They serve everybody. They have the interpreters. They do the charity care. They do the whole thing. And I'm frankly proud to be affiliated with them. Thank you for your time.
Thank you. Melissa Barrero, please.
Hi, everyone. My name's Melissa Barrero. I'm the Director of Business Development at Charter Care, and I've been at the organization for 17 years. My role there now is focused on seniors in our community. I manage a program we call the Nursing Home Initiative. It serves as a liaison between the hospital, nursing homes, assisted living communities, and their patients. The program ensures that our community's most vulnerable members get the care they need from their preferred doctors. Charter Care is the only hospital system in our state that does this, that focuses closely on the patients who need the most care. Our emergency rooms even accept patients from as far away as Westerly or Newport, when no local options are available to them. We take great lengths to accommodate all patients we treat. We also help the facility navigate the continuum. This is especially true for geriatric patients who need psychological care. I know because I am in these facilities every day, and I hear how challenging it can be for the staff to manage patients with complex needs. I support Charter Care's application because the patients who live in the surrounding communities are counting on us. Centurion is the perfect partner to ensure that Charter Care gets back on solid ground so we can continue our mission. Thank you.
Thank you. Ann Dugan, please.
Here over Roger Williams, Fatima, and offsite Blackstone Valley Surgeon Care. Ironically, I began my nursing career at Roger Williams, as we call it, the Raj, in 1980. Now I've just aged myself in this entire room. But anyway, in addition, I started the inpatient surgical oncology program with Dr. Monaco. Sadly, my brother Dennis Lynch was one of his first Rhode Island patients. Happy that we had that care there. The Raj is an extraordinary community hospital that has continued the surgical oncology program by Dr. Soma Sunder in the audience throughout the years, as well as many other service lines that meet the needs of the patients in our surrounding communities, including my family members and friends. In 1989, I had an opportunity to pursue a career change in ambulatory surgery with surgical care affiliates, but I came full circle back in 2017 to the Raj and brought my Blackstone Valley Surgeon Care Surgery Center with me to the Charter Care portfolio. It's been a wonderful homecoming. Incredibly, I got reacquainted with many staff members that had worked there when I had worked there back in the 80s. And over the past 6 years, I've seen the dedication across the board, from Jeff Liebman and his leadership team to the outstanding doctors and nurses and other professionals, all with one goal: to ensure our quality care to all the patients we serve. The Raj and Fatima, for me, both professionally and personally, are the hospitals that I want to work with and have chosen to be affiliated with. I'm confident that Centurion, with our local leadership, will continue the tradition of excellence, and I hope that you will approve the application. Thank you for your time.
Thank you. Susan Beliveau, please. For any individual wanting to speak that is joining us virtually, please raise your virtual hand so we can unmute you. Call again on Susan Beliveau. I'll move on to Sherry Clavette. Cherry Clavette.
She is unmuted on Teams.
Cherry, are you able to hear us? You are unmuted if you'd like to provide your comment.
Thank you. Yes, I am the VP of Compliance and Privacy for Charter Care at both facilities, and I have been here since the fall of 2019. I wanted to share something that I don't see very often. I've been doing this a very long time. I teach at each orientation when new employees are coming on. And one thing that I've noted that I haven't seen in any other place that I've worked is the rate of return of employees who come back to Our Lady of Fatima or Roger Williams. And I just think that that is a remarkable testimony to how wonderful this organization is. And thank you.
Thank you. Dr. John Stukides, please.
Stukides, I'm staff at both Fatima Hospital and currently serve as the chairman of Medicine at Roger Williams. I'm a lifelong Rhode Islander, grew up in Pawtucket, family owned a little bakery in Pawtucket. Went to URI, I get a good Rhode Islander shirt. Left Rhode Island to go to Boston to medical school, but my parents couldn't figure out why I did that. But one thing I did learn in that time was how great Rhode Island it was, and really the uniqueness of not having huge healthcare systems and small hospitals and how great they can really be. I came back to Roger Williams in 1989 and I haven't left since. And the main reason for that is, at least from my point of view, is an absolute commitment to caring for patients in my role, I'm a geriatrician, caring for elderly patients. I've been allowed to grow our department, grow our affiliations over that time with the leadership we've had at the hospitals. We were able to link up with both Rhode Island College and University of Rhode Island on the state's own first Rhode Island Geriatric Education Center through commitment from Roger Williams to do that. They've been able to add geriatricians in the area and the state that's very fully reimbursed for primary care and geriatrics, and been supported by the hospitals. I was with the hospitals when we realized that we couldn't survive alone and we joined up with Fatima. And then we were limited by access to funding because little guys can't get good loans like big guys can. And we didn't have that ability to get the funding. So we linked up with Prosper. And initially it was a wonderful thing. Everyone was opposed to bringing in private venture capital to the state, but they invested in us. They allowed us to grow. They provided funding for our infrastructure. But then that process came with its prices. We weren't able to get grant funding for our academic programs anymore. We weren't able to give loan forgiveness to encourage our residents to come in and stay in the state because of our for-profit status. And more importantly, recently, they've lost interest. They want out of the state. They're not paying their bills. They're not doing things that they need to do. And we really need to move on. Other good thing that's come from them, they built an excellent support administrative. This team under Jeff's leadership and the rest of the administrators got us through COVID with one of the best outcomes for COVID patients anywhere in the state or in the country. We were phenomenal at taking care of COVID patients under the same leadership team that's going to continue to guide us through this. We continued to survive through a cyber attack, which we triple-wise. Under our IT department were the first in the prospect system to come out of the cyber attack because we put together a great team and we want to keep that going. We know now that private equity doesn't work. Look to Massachusetts, what's happening with students. We need to get back to private, to local control. And that's really what we think we're going to do. Get to a new chapter, get, like Ms. Powell said, focused on quality access to what Rhode Islanders need to access Rhode Island, healthcare in Rhode Island again, get a local board to direct us and move on to the next chapter. We, on the medical staff and all the docs I've talked to and the nurses in my hospital that talk to daily, continue to support us and say, we need to move on. Let's do this as soon as we can. And we wholeheartedly support Centurion's application. Thank you.
Thank you. Dr. Rebecca Brown, please. Amanda Cox, please.
Keys for mentioning the cyber attack. Thought I would get through this without talking about that. I've been with the organization for about 15 years. I started out as a clinical systems analyst supporting our lab department and have gradually worked my way up through the organization. Back in 2014, when Prospect Medical Holdings purchased Charter Care as a joint venture, our IT department started to become centralized and outsourced. We outsourced a lot of our services. We went from a department of 54 employees down to a department of 10 today. With Centurion partnership, we'll be able to break off and start to rebuild our IT department. This will allow us to bring more jobs back to Rhode Island and provide better service and support that our hospitals so desperately need. With this, I urge the approval of this application. Thank you.
Shannon Celeste.
Many surgeons who love to come to Fatima for many services we provide, along with our efficiency and overall care and professional attitude. Our services range from pediatric dental, cataract, podiatry, a lot of services, urology, total joint replacements, neurosurgery, ENT, plus general surgery. Over the past few years, we've added advanced technology to our OR with the Mako robot by Stryker, for total knees and hips, as well as the Globus Excelsius robot for neurosurgery. We're also very proud to be one of the first hospitals in Rhode Island to be doing the Inspire procedures, which is an ENT procedure for patients that have sleep apnea. I'm very proud to be part of the Fatima family. I have 2 daughters and a granddaughter who have had surgery at Fatima. I would also like to share a few comments of the reviews I've received from patients via pods and our Google Business Review. I had a recent procedure done at Fatima Hospital, and from start to finish, it was one of the nicest experiences. Staff and Crystal at the front desk and Joyce during pre-op, and Susan in recovery was incredible. So welcoming and thorough. I would definitely recommend Fatima to friends and loved ones. Great facility. The staff from the nurses and doctors to the pre-op staff are incredibly supportive, nice, and knowledgeable. Overall, my second knee replacement surgery went perfectly. Highly recommend the hospital. And we also get cards and letters. It's endless. I'd like to take this time to thank each and every person who were involved in my procedure. You all gave me the best care that was over and beyond what I expected. You all made me feel very at ease and relaxed. It's my first time at Fatima, and I can't tell you enough for all the staff. Thank you, thank you. So these letters and reviews are why I'm so blessed to work with all of my amazing staff, surgeon, and anesthesiologist, and all of the Fatima family. We need the not-for-profit Centurion application to be approved. It is crucial for the well-being of the state and especially our community. Thank you.
Thank you. Jennifer Hudson Parker.
I've unmuted your mic, Jennifer.
Hi, good afternoon. My name is Jennifer Hudson Parker. I'm one of the nursing directors of the surgical oncology inpatient program at Roger Williams Hospital. And I've been there for the last 27 years. Certainly, I've seen a lot through the last few years, most recently inadequate funding, to which we have not been able to pay for services, supplies, equipment, and things like that for our patients. I'm going to share an actual story from one of our patients who really has been with us for the last 5 or 6 years. And she really tells the story of how she has watched some of the neglect happen throughout the years and what the nursing staff is capable of doing. So I'm just going to share. I write this to you as a concerned member of the Rhode Williams Medical Center community. As you know, I've been hospitalized more times than I care to count over the past 5 years. During this time, I've pretty much been treated very, very well, inpatient, outpatient, home care, radiology, OR, and of course the business office. I can honestly say that I have always been treated with courtesy and compassion. I cannot praise enough the professional staff as well as the ancillary employees that are here that deliver kindness, hard work, dedication, and certainly compassion. But, she says, Rhode Williams is not without its faults. Staffing, infrastructure, and lack of broken equipment immediately come to mind. The current owners of this institution have made millions of dollars from this for-profit facility. If you are an inpatient, I hope that it doesn't rain because there are leaks everywhere. She goes on to say that the nurses, waste time by setting up IV pumps and finding out that sometimes they're not working. She wanted to take the time and the opportunity to discuss these issues before the hospital is sold. The people of Rhode Island want and need Rhode Williams Medical Center. However, it needs to return to the thriving and vibrant facility it once was. Remember that not all change is progress. If it isn't an improvement, it isn't progress. She asked to the powers that be, I say, please think long and hard before you make this decision. Please vote to approve this acquisition. This is from a community member and a well-known patient here at Rhode Williams Hospital. Thank you for your time.
Thank you. Dr. Nabil Tubia. Okay, thank you. Dr. Ponandai Soman Sundar.
Great job.
Thank you.
Thank you. My name is Dr. Somasundar. I'm one of the surgical oncologists. I've been with the facility for the past 20 years, and I'm the division chief of surgical oncology and the vice chairman of surgery. There is a lot of my patients for a period of 20 years. We treated them across the state and all from Southern Mass, and people come from all over the state to us. And we always say if there's a difficult patient, that cancer patient to treat, please send them over. We will take care of them. We have 5 partners, and not only do we take care of these patients, there are a lot of underrepresented minorities and a lot of geriatric patients. We know that cancer incidence is mainly in the elderly. So we take care of the elderly who are underrepresented in a lot of ways. And we do have what's called a geriatric surgery verification program, which is unique to Rhode Williams. And in addition, we also provide a lot of work for the underrepresented minorities with a good, solid navigation system, which is part of the whole thing. We almost have 18 to 20,000 cancer visits per year, which will be hugely affected if these hospitals don't exist. I think it's a responsibility and an accountability within the community that these hospitals need to exist. And in that regards, if you look at it, that not becoming a not-for-profit status, we not only do clinical work, but we teach. In addition, we do a lot of research. Research, unfortunately, do not give money to people who are for-profit organizations. They mainly do it for not-for-profit organizations. And in fact, at one point in time, Jeff and I were trying to set up an international meeting, and we were trying to approach Rhode Island Foundation, which actually will not give us money because we were a for-profit organization. And I think which will be a big boon for us. And at this present time, I don't think there is any other organization supporting us in that regards. I think Centurion will be a big boon to improve our quality of work, and in terms of affordability, and in terms of getting the underrepresented minorities into the whole healthcare scenario. Thank you.
Thank you. Joe DeSantis.
Joe DeSantis, if you are online, please raise your hand so I may unmute you.
Joe DeSantis. Move on to Dr. Louis Mariorenzi. Okay, thank you. Maria Leonard. Chris Kalachi.
See you guys again. Chris Kalachi, I represent the United Nurses and Allied Professionals. Last name is spelled Callaci. I have the good fortune of representing the Sea of Purple in here. These are the folks who are the backbone of these hospitals. Without them, these hospitals would not be here. We rise in opposition to this application. And the reason why we do so is as follows. These hospitals lost $88 million between fiscal year 15 and fiscal year 20. They continue to lose money at an unsustainable rate. Centurion's model calls for these hospitals to stand alone and be self-sustaining. They will put no money into capital projects. They will put no money to cover the operational losses. This is a no cash deal, 100% debt financed. We are supposed to go to the bond market, meaning the local hospitals. Go to the bond market after you approve the deal, after you give them the keys to the facilities to borrow a principal amount of $133 million at a 6 to 7% probable interest rate. Nobody's getting those rates right now. Now, the principal amount is $133 million. Those bonds come due in 10 years, add another 93 in interest. Those bonds come due in 30 years, add another $279 million in interest. This crushing debt will hasten the demise of these hospitals because the debt is not being taken on by Centurion. The debt is being taken on by these facilities that are failing financially. Even the embattled and disgraced Prospect put $64 million into these facilities. No money is coming from Centurion. Now, if we get the bonds, the hospitals are supposed to pledge their revenues to secure the debt. They don't have the revenues to secure the debt. If that doesn't work, they're supposed to take mortgages out on their facilities. Who knows if there are ever even any liens on those facilities. The $80 million figure that's going to be put on the balance sheet, that's borrowed money. That's money the local hospitals are borrowing. That's not a capitalization infusion from Centurion. Now, you go to the bond market, we don't know whether somebody's going to issue the bonds, and it's after the deal. What if we don't get that financing? Look, the model is based on finding untapped savings and generating new revenues. These hospitals have been trying to do that since prior to the affiliation of Roger Williams and Fatima Hospital back in 2009. They couldn't do it then. They couldn't do it as Charter Care from 09 to 14. They couldn't do it as Prospect Charter Care from 2014 to 2024. Centurion doesn't own hospitals. It doesn't operate hospitals. It doesn't know how to. How are they going to help us find untapped savings we have not been able to find for 15 years? It's not there. Regrettably, it is not there. We would prefer to embrace this business model, but it fails. And at the heart of the Hospital Conversion Act is to make sure that application is approved, that the viability of our healthcare infrastructure in this state is secured. And if this application is approved in its current form, not only will it not be secured, but the future of these facilities will be in serious jeopardy. Our union asks you to reject this application.
Thank you. Tracy Crandall.
I joined this team knowing that this partnership would return me to a non-for-profit organization rooted in the foundation of Rhode Island support and staff members is the best path forward. In my short period of time here, I have been inspired by the commitment of the position, leadership, and story is not one story. Dr. Bowman, our chief nursing officer, went to nursing school here, and she's now been here for 39 years. When there are challenges in front of charter care, the amount of people that come together, throw their titles aside, and make it happen is truly inspiring. One of the things that keeps the human resources person awake at night, to be quite honest, is making sure we bring new talent so you can do what you guys do best. As we are facing bringing new talent who have not had the experience of charter care, we do have a lot of problem writers. They come back, the grass wasn't greener, and they return to us at a very rapid rate, and they return because of the culture. But as we go to attract new talent, and post-COVID, we are not the only organization that's having a talent challenge. It's facing healthcare and providers all the way down to diagnostic imaging. One of the things that has been challenging for us is the waiting period. And as we look to attract talent, there's some uncertainty around what is the future, where do we go? I strongly support this partnership with Centurion. It'll bring sustainability and stability back to the organization, and we can focus on what we know we do best. Reinvesting in Rhode Island, in the people that are best served to deliver care. Thank you.
Thank you. Donna Saul.
Here. I've been a nurse leader for 40 years in both Massachusetts and Rhode Island, and I've held various roles in small community hospitals, academic medical centers, and pretty much everything in between. Each institution has its place. We would be lost without the tertiary and quaternary facilities to provide care for the dramatic, the exotic, and the complex. The community hospitals are the lifeblood of healthcare. It is within those walls where families seek compassionate care from the dedicated staff who work so very hard to provide it. It is that incredible staff who want to care for their neighbors, their friends, and each other's families. When I'm on the units and have the opportunity to speak with patients, I hear from them their praise for the care they receive. It's their privilege. From ER arrival, even at X-ray and MRI. So when I went upstairs to my room, it was an amazing experience. The nurses at ER and upstairs were so professional and caring. My husband and I were very pleased on the floor on the care I was given. He told everyone how well I was cared for and treated. For a hospital, very good experience. Nurses answered every question I asked. Meds were told to me every time they were given to me, and as I had new medications. They are excellent nurses and they have human quality from another level. And finally, I do not have words. Thank you for saving my life. God bless you all. Healthcare today, in every setting, is faced with multiple challenges. The pandemic altered the trajectory of the work that we do. It made finding qualified and committed staff just that much harder. We're in a good place, but need to be be able to continue to recruit so that we can support the growth that our community needs. We are challenged today as long as the future of charter care is uncertain. So too do the challenges of an uncertain future impact our physical resources. Good equipment makes the difficult work that our staff does so much easier to do. We look forward to our future when updated computer systems and patient care equipment will be more available. Community hospitals excel at the basics of healthcare and doing them well. I have the privilege of working with a leadership team that's devoted to making that happen every day. I look forward to the future of charter care where everyone can use their considerable talents to make the path of every employee smoother. Centurion stands ready to walk alongside us to bring us to the brighter future that is just over that horizon. If we are providing great care to our communities today, with the challenges we're facing, I know that we will be able to take the giant steps forward that will secure these hospitals for that future with Centurion on our side. In closing, returning to a nonprofit status, keeping local money local so that staffing and resources are available for the growth we see, and the ability to let the leaders lead is just what the doctor ordered. I ask you to approve this application to preserve the community hospitals of Charter. Thank you.
Thank you. Dr. Ritesh Rathore.
Thank you for the opportunity. My name is Ritesh Rathore. I started at Roger Williams Medical Center as a hematology oncology fellow in the previous century, 1997. I stayed on. I currently serve as a division chief of hematology oncology, and I'm teaching faculty at Boston University for our teaching program in hematology oncology. Everybody has been supportive of these institutions in the community. I would like to just add a few words in terms of the utility and the necessity, the sustainability of these institutions in our local space. I will only talk about what I do best and know best, which is the cancer care programs and the educational programs. We serve about, as my colleague had mentioned, 18 to 20,000 outpatient visits a year, but with specialized high quality programs, including complex surgical oncology, hematology oncology, as well as bone marrow transplant. We are the only full service BMT unit, and we are going to introduce aggressive immunotherapy options, which have been approved, which is, again, a first for the state and for our patients. What was briefly alluded to was that we serve the minority population, which is an increasing and up to a third of the cases we see. But we also see federally underserved populations coming from the PCHC system, from the Thunder Mist clinics, and we are a very vital access point for their cancer care services. As being in the training area, most people talk about providing training programs, but our graduates, whether they are in medicine or in the fellowships, not only work in the charter care system, but across all systems. You will see primary care doctors trained at Roger Williams working across the state, working as a hospitalist at Kent or down in South County, and they provide services for the state and the region as a whole. And so I think that's a very vital area. As a not-for-profit institution, we'll have significant direct cost savings in drug costs, which will help the sustainability of the cancer programs. And I think we can't do that unless we become not-for-profit. And finally, we will be able to attract more research funding and actually better talent in terms of physicians and allied medical staff, which can serve our population and our programs. So I think we have a utility in the area, we have the need, and I think the sustainability comes from growing the programs and going forward with the ownership change. And that's why I would like to talk, and thank you for the opportunity.
Thank you. Lynn Redding.
My name is Lynn Redding. I am the president of Roger Williams Medical Center, Local 5092. We are the nurses union. First, let me start out by saying I agree with Mr. Liebman. I agree with Dr. Stukides. I agree with so many people who've spoken so far about the level of care that we provide. at these hospitals. That's not the debate. That's not the issue that we are here for. We know that we take great care of our patients. We know we have great doctors. The cancer center is outstanding. We're not saying we don't want a nonprofit. What we're saying is we don't want this nonprofit, because right now there are way too many unanswered questions. One of them is, what are the services they are going to provide for us? Those services have been redacted from the public record. What fees are they going to charge us? We're the ones funding this situation. We're the ones, as a hospital, between Roger Williams, Our Lady of Fatima, and the home health care, we're the ones who are having to support this endeavor for Centurion, for a foundation. We know that not-for-profit is better. We all have that belief. That's not the issue. But we are not Johns Hopkins. We're not Beth Israel Deaconess. We don't have that kind of funding behind us. And for us to lay ourselves open again for financial loss is a huge mistake. The best example I have is if you go into the hospital and you say, I'm not feeling well. And we say to you, well, okay, I think we'll do some surgery. We're pretty sure that we'll have board certified surgeons and anesthesiologists, and we should have your recovery room set up, and we're probably going to have great nurses for you. But we're not going to actually formalize this and really put it down on paper until after we've done the surgery on you. Are you going to send your child to that hospital if they can't give you any kind of an assumption of a guarantee? Are you going to send any loved one? Are you going to go there? If it's all left up in the air until after the procedure, and that's what's being asked of us. We are being asked to just assume it's going to go well, and we'll give you everything you need after we have closed the deal. So again, we ask you to reject this offer.
Thank you. Mike Salerno. If attending virtually, please raise your virtual hand. I'll move on to Josephine Cheleni.
Josephina, if you're attending virtually, please raise your hand.
There is a virtual hand up in view all.
This is a reminder to the virtual participants that there is an online form to sign up to speak. Please only raise your hand once we call you. That way we can unmute you.
I'll try Josephina Cheleni one more time. Sherry Perry. Sherry Perry. If attending virtually, please raise your virtual hand. Susan Pratt.
Hi, I'm Susan Pratt, Pratt. I work at Fatima Hospital. I've been a nurse there for 33 years. I agree, we have some of the best nurses. We all work together well. Actually, everybody works together great. And we're just very concerned about what Centurion is going to bring us. You know, when Prospect took us over, we thought that things were going to get better, and instead they really didn't. And there's just too much that we don't know right now about Centurion, and we're concerned. And that's all I have to say.
Thank you. Ryan Pagliaro.
Good evening, everyone. I work at Fatima Hospital. Been here about a year and a half. Yeah, I'm not really gonna back this deal. The money doesn't add up. It's common sense. Everything's redacted in that application. Unless it's something I don't know, unless we're gonna be drilling for oil or mining for gold in the parking lot. If we are, that'd be fun. And I also question why anyone would want to take this on and not front any money their smells. That's all I have to say. Thank you.
I'll try Sherry Perry again. Susan Beliveau.
There is somebody with the last name Beliveau who I've unmuted. So Susan, if that's you, you are unmuted.
Is there a person by the last name Beliveau that would like to provide public comment? Joe DeSantis. Dr. Louis Mariarenzi. Maria Leonard. Josephina Cheleni. Dr. Nabil Tubia. Donna Saul, I believe, spoke. Right. Okay. So is there anyone else in attendance who would like to provide comments but has not had an opportunity to speak tonight? Online as well, please raise your virtual hands and you will be unmuted. Please come to the microphone.
Well, Cerberus and Stewart Healthcare wanted to buy Landmark Hospital, and I was the only one that went to Woonsocket City Hall testifying against it. I kind of got booed when I said, "Is this the type of company you want to be taking over a Landmark Hospital?" We all saw what happened. Unfortunately, the deal fell through, and we saw what happened in Massachusetts with private equity. I've just been following closely my offices in East Providence. And I was very concerned that a little bit behind the data from all you guys, but I'm reading and Leonard took $658 million out of the corporation from what I was reading. And they sold the real estate and they're going to be paying debt on the property that they own. And I'm just concerned that it's going to go bankrupt either way. And it's going to go bankrupt if it gets taken over or if it gets with the same company. And I'd like the people that did this to kind of bear the responsibility for it. That's what's happening in Massachusetts. They're just kind of fleeing the deal and they don't want to maintain responsibility. I was very impressed by Chris Kalachi's or the UNAP's advertisement saying they oppose it and the reasons. That made a lot of sense. One last comment though. So I'm not up on the details of the finances. And I had a hard time finding it online. But 31% of all the money in private equity comes from public pension funds. That's what did it to you guys. That's where private equity gets their funds from. And I think the state of Rhode Island has to stop that, nationally. And I think it's a national problem because what's going on in Massachusetts with Stewart is just as bad. Thank you.
Thank you. Is there anyone else in attendance who'd like to provide comments but has not had an opportunity to speak tonight?
There is someone online that has raised their hand. So the user with the last, the name Vijay Sudhim, you're unmuted.
Can you guys hear me?
Yes.
Yes.
Yeah, so my name is Dr. Sudhindra, one of the anesthesiologists from Rhode Island, and I work in several hospitals. We have a group called Narragansett Bay Anesthesia. I am the CEO of the group. I have been in Rhode Island for the last 20 years. I have worked in all healthcare systems, competing healthcare systems. We have been providing service at Roger Williamson Fatima for the last 10 years. The reason why this is very important to us is we have worked in hospitals in Massachusetts, New Hampshire, everywhere. But the healthcare, I believe, is local. It is not national. It has to be served locally. The leaders have to be there locally. And that's where the investments have to happen. That's where the medicine profession has to be furthered. With that being said, I can only speak for the Department of Anesthesia. We are facing unprecedented staffing shortage. We are having hard time keeping the lights on in the operating room in the hospitals for a variety of reasons. We haven't been able to attract any physicians nor nurse anesthetists because of reasons that are beyond this meeting. But I know that the state of Rhode Island is working to kind of improve that. But with that being said, the local leadership of Roger Williamson Fatima, I have had contact with several leaders in my career, but Dr. Liebman is one of the outstanding leaders who understands the vision and the strategy of these hospitals, and especially the minority and the underserved as these hospitals are centrally located are taken care of. These hospitals have to survive. They need to be relevant to the community of Rhode Island, and we want to be part of that. So rendering these hospitals to nonprofit status would help us tremendously. Would also attract more physicians and nurse anesthetists to the organization, and we can have a strong competition in this healthcare arena. Otherwise, we are going to have one healthcare system that's not going to serve good for anybody. So I am speaking in support of the application today.
Thank you. Dr. Nabil Tubia, please come to the microphone.
capacity as the district goal is 2004. I've been serving the same since then. These strongly those community hospitals are very important. They serve an excellent purpose, and we offer quality services to our community, regardless of patients' insurance status, regardless of their race or color, sex, and we do that full-time. I'm not proving that I'm the product of that system, and I'm looking to grow that. We lost several gastroenterologists in the past year. We lost them, unfortunately, in Massachusetts. I don't want to see that happen again. We'd like to grow the community gastroenterologists here, but we need to serve the community. We hired 2 gastroenterologists over the past year. We are trying to grow the fellowship program. And our system can train those very well. By using the existing community of hospitals, we support the programs that we have. Thank you very much for giving me the opportunity to say a few words about the programming.
Thank you. Dr. Louis Mariorenzi.
It's been my home for a long time. It's a terrific hospital. I was supported when we went for profit. I was told that for profit was really the same as not profit. Everybody's working to make a profit. What I didn't realize and have learned is that the issue is what happens to the profit after that. And the nonprofit, profits put back into the hospital, better nursing, better technology, infrastructure needs in the for-profit. Although there was some initial investment, that money leaves. That money goes to the investors and maybe a jet, maybe a bigger yacht, maybe a mansion, but it doesn't come back. So I would like to see Fatima and Rhode return to the good hospitals that they were. I would like them to go back to a nonprofit status with local governance and move that money forward back into the system. I hope that you're able to redirect it back to the nonprofit setting and hope that you will find it here to improve the same. But thank you.
Thank you. Sayer Abdel Fattah.
About the growth of our division of gastroenterology, how busy we are. We need all the support we can, obviously. So the sale talking to you is a very, very important thing for our division, for the hospital, and for everyone involved, because we need all the support we can. Thank you.
Thank you. Is there anyone else in attendance who would like to provide public comments?
Yes, there's someone online. Jeffrey Betchen, I'm unmuting you now. Mr. Betchen, you've been unmuted.
Good afternoon. Can you hear me?
Yes.
Yes.
Thank you. Thank you for the opportunity to speak. I've been with Charter Care since July of 2019, and obviously I was not there for the initial stages of the engagement with Prospect, but I have been, I've been a part of many of the ups and downs that we've been through over the last several years, particularly the last 2 to 3 years. One of the things that is not being mentioned when we talk about the plans to try and turn this around through finances has been our performance as an organization in terms of the revenue operations. So I will be staying on as the Vice President of Revenue Cycle Operations. My team is responsible for everything from registration through sending the bill out the door. And our metrics have constantly been the top in all of the Prospect facilities. And I know, I feel it, believe it in my heart, that if we can eliminate some of these corporate overheads that are thrown upon us due to being for profit, and we can manage our own money, we can make money quick enough with help to turn this around. And I haven't heard anything like that. I just think folks should know that in terms of how well we do at getting paid by insurance companies, we do it just about as well as anybody around in the Rhode Island market. Thank you for the opportunity to speak, and I hope you approve this.
Thank you. Anyone else in attendance today who would like to provide? Please come to the mic.
Good evening and thank you. My name is Lynn Blaze. I am president of United Nurses and Allied Professionals, but more importantly, I'm a registered nurse and I have spent my entire 40-year career within the St. Joe's healthcare system, currently in the recovery room at Fatima Hospital. And as I'm sure you are aware that the UNAP is adamantly opposed to this deal as written. But I want you to know, we as a union, we as employees are committed to this organization. We want to see it succeed. We know the importance of it succeeding. We know the community counts on these hospitals. We know we provide a service that no other hospital in the state can take on. We have over probably 200 mental health beds. We see over 50,000 patients in our emergency rooms every year. We serve the underserved. So we need these hospitals to survive. But Centurion's deal as written is not going to make us survive. It is going to put the final dagger and close the doors of those hospitals forever. So for those reasons, I oppose it. The UNAP opposes it. And we hope that they can come back to the table with a way that they put money into those hospitals to make those hospitals survive. Thank you.
Hello, my name is Anthony Riley. I've been a nurse for about 10 years. I've only been at Roger Williams for about a month. I wanted to reiterate a couple of things that I heard today. I've heard a lot of nice stories about a lot of individuals, about the hospitals themselves, and I don't think any of that's really, it doesn't seem to me any of that's really in dispute. I think they're probably, they are good hospitals. I use the services that Fatima, myself, and my wife. I was happy to go there. But unfortunately, I think as a couple of people have pointed out, it's really not the relevant question. And I wanted to relate why I say that with a little anecdote. When I was in nursing school, I took a course to get my bachelor's degree. First of all, I took we had one required course in statistics, which we took, and then I took a course in qualitative research. Now, in that course, they wanted us to do some research, to find articles about a particular thing, and go through those articles and give our, kind of analysis of the quality of the research that was done. But they realized that we really didn't have, a sufficient statistical background. So the way they presented it was like, okay, so take a look at the research, read the abstract, look at the methods, well, skip over the statistics because you're probably not going to follow. And then read the conclusion, okay? And then you can give your analysis of that research. Well, in my prior life, before becoming a nurse, I actually worked as a test development engineer in the semiconductor field. So I had a fairly, I had a fairly reasonable background in statistics. I'm not a statistical expert, but I was able to go through these articles and evaluate the statistics. And much to my surprise, some of the articles I read didn't really support their own conclusions. So it seems to me that what we're looking at here at the moment is, okay, what's the abstract? Well, we want to save the hospitals. Yes, we're in agreement to great hospitals. What's the methodology? Well, that's Centurion buying, right? Because they've come forward. What's the conclusion? We're going to be nonprofit and everyone's going to live happily ever after. But they're kind of skipping over that, that statistical part. How? And what I'm seeing from, our representatives is that question is not being sufficiently answered. I'm not even sure, like I said, I've only been here a month. And I'm not really even sure that we're 100% opposed as much we're opposed to not having the information. If you want it done, you have to answer the questions. You cannot keep things hidden. Thank you.
Thank you. Is there anyone else in attendance who would like to provide public comments?
Lydia Wagner, I have unmuted your mic.
Lydia Wagner?
Can you hear me? I'm so sorry.
Yes.
Yes.
Oh, thank you. I do have this laryngitis, but I wanted to take the opportunity to say a couple of words tonight. Um, so my name is Lydia Wagner. I'm a geriatrician over at Roger Williams. And not only that, I'm a graduate of Roger Williams from long ago. My own medical career started back in Europe, in a remote part of Serbia, and I came to the Raj as an intern. I completed my internal medicine residency, and with the training and mentorship that I received over at the Raj, I was able to get a pretty prestigious geriatric fellowship down at Duke University, where I stayed on for several years getting some advanced degrees. I came back to Rhode Island eventually and ultimately back to Roger Williams. And I'm just going to reiterate what everybody has said. When I came back, it literally felt like I was coming back home. It felt really good and sometimes a little deja vu to be surrounded by folks who had spent their entire careers in this particular healthcare system. So folks who were there when I was an intern and a resident who are still there, awesome mentors, just really dedicated and loyal folks. And I think we've heard from several people basically saying the same things. The amount of trust and loyalty and just kind of devotion that we all feel towards these hospitals and this healthcare system is totally equivocal. The other things though that I could say is, having worked in different healthcare systems, both in the South and then now up here, is it's really good to be in a stable healthcare system, in the sense that the turnaround and the turnover is just it's low. These are folks who've dedicated their whole lives, and I see it throughout, like nursing and technicians and our radiology department and other disciplines that we have. Being in this kind of supportive environment not only gives me that security and stability, but I was able to start a geriatric medical fellowship program, with obviously help with so many other people. And through that fellowship, because of the kind of network and the fostering and this just rich environment that we're in, we've been able to do so much, bring about so many initiatives in a very short period of time that's brought enormous benefit to the older adult population in Rhode Island. We're working on innovative models of care like geriatric emergency rooms, and partnering with the surgery oncology team to do collaborative care and co-management, and just things that one wouldn't really expect from a small community hospital, but that we're able to do from Roger Williams. One, because we have access to such great mentors, and two, because of the network and the kind of environment that we are in. Three, because of all the training and learning programs that we have and all the trainees that we have that then go out into the world and disseminate. And so a couple of things. Um, I am inspired every single day by Roger Williams, and not only by the people that I've already kind of mentioned, but just like the very hospitals that have this very unique spirit that I've never encountered anywhere else. I would really hate to see that disappear. I personally am speaking today in support of this partnership, but I also ask the group, if not Centurion, what other options do we really have? And I know I'm maybe naive in thinking that, but I would just really hate to lose what we have. It is truly special. Thank you for your time to speak today.
Thank you. Can you approach the microphone?
Just wanted to introduce myself. I'm Cindy Benchel, Fenchel. I'm a medical secretary at Fatima Hospital for 46 years. That's more than some people are the age in this room. So I'm also the union president for my local 5110. I represent the very hardworking service workers, dietary, phlebotomy, housekeeping, secretaries, etc. Very hardworking. I would say after our last contract, they're pretty decently paid, but considered the lowest paid in the hospital. I'm not usually a public speaker and I wasn't going to talk today, but I do feel there are some things that I need to say on behalf of the service workers. I will say that the question comes up, if it's not Centurion, then who? I feel, and I have educated myself and learned that we will struggle with Prospect, but we will fail with Centurion. And this is a community hospital, and it is our job to make sure it does not fail. And then I would also like to say to Centurion Direct, if you value all these healthcare workers like you say you do, you have not put a comprehensive health plan on the table. We don't know when you buy us, what will we have for health insurance, because we have Prospect Blue Cross now and we have to get rid of it if you come in. So you're not being honest. There's too many things that are redacted in that. And I also want to know how many people in this room read the application. Leadership is the first one to say it's great. Our attorney, Chris Kalachi, he read it. It's this high and it's double-sided. And we took the time in our meetings to learn about it. How many of you read it? And it's wonderful that you all have guarantee for jobs here. Of course you like Centurion. Leadership has a guarantee to have a job, while this week my members are getting laid off and I have been fighting to save their jobs. And that's what I have to say.
Thank you. Is there anyone else in attendance, either virtually or in person, that would like to provide comment?
Yeah.
Please approach.
Sorry, there's
Oh,
Kimberly Valent. I've unmuted your mic. Kimberly, raise your hand online. Your mic is unmuted. She has lowered her hand.
member in the public, if you'd like to approach. Yes.
Now? Hello?
Oh, sorry, is that Kimberly?
Yes, it is.
Okay.
Sorry about that. Thank you for
That's
letting
okay.
me speak. There was a question about the how, and I'd like to, what I know of it and what's been shared. There would be an $80 million cash infusion to help recapitalize. And when we talk about there's the current ownership, we do seem to be struggling. We've had some challenges with that, even to the point of purchasing paper. And to share some research with folks, do research on the Pennsylvania hospital and what happened with that under Prospect. I do think Centurion is offering something to keep the control locally, keep the money locally to Rhode Island. I think going back to a non-profit status, it will definitely help Rhode Island. And I think that you don't want to be in the place that you're seeing some of the Massachusetts hospitals under the Stewart ownership currently. I think that if anyone is really watching all of this and watching the barometer across the country, you'll see that there are many hospitals struggling. By keeping your current leadership, which is very strong at these two hospitals at Charter Care in place, and working together, I think that is our best opportunity to keep the hospitals thriving for both Rhode Island and for the employees. Thank you.
Thank you. Please approach the microphone.
Beefed up from 2 people to about 8 people to 9 people. We have no support out there. And what I see, I really don't see, I hear this great thing about not-for-profit, all these great plans, everything's great. But out there, we're working sometimes till 8 o'clock at night. I drive the whole state. I'm the only OT for this agency. Has there been a job posted to support this? No, there has not. We have no jobs posted to support the direct line clinicians out there. And UNAP, I mean, I don't see where the reality is in Centurion taking over and going to make things different. I see things just getting worse because of how tight the reins are being pulled in and just generally where healthcare is going. So I share the frustration of all my union members with me and not knowing where we're going. We're sitting in the dark.
Thank you. Anyone else? Please approach.
I wasn't going to speak today. Oops. I've prepared remarks, but I'm pretty moved in speaking now without them. Plus the paper will just shake. My name is Bob McDonald. I'm a clinical social worker at Fatima Hospital in the outpatient behavioral department. I love my job. I've been there for almost 5 years. I've spent my entire career as a social worker, which is 25 years, working in nonprofits. Some have been great, some have been not so great. The argument that I'm hearing here is not so much a nonprofit type of thing. We're looking for transparency. That's what we're looking for. I make treatment plans for my patients. How are we going to get where we need to get in, say, 3 months? By meeting with me and the doctor weekly. Let's put down some objectives, evidence-based objectives. We've all been trained in this stuff. We're asking for the financials to do the same. I know it might be too soon to say this, but we've all heard I have a bridge to sell. And that's what this really feels like. And maybe they haven't been tormented by our great roadways, but this seems like we'll be tormented moving forward with not knowing any transparency as to what they have to do. Thank you.
Anyone else in person or virtually that would like to provide public comment?
Yeah, next Tuesday, but we have about the moment.
And as a reminder for folks online, please raise your hand if you would like to offer a comment.
Is there anyone who has already provided comment today but would like additional time to comment further? Well, hearing no one and, oh, you have some? No?
Kimberly?
Thank you. I would just say, to everyone in
Excuse
the
me,
room,
can you just let us know what your name is? Kimberly, what is the last name?
Kimberly Valiant.
Okay, thank you.
So I would just say to everybody in the room, think about the current state of where we are, the jobs that we can't get, hearing about how those jobs aren't being posted. We're seeing it in my area as well, but we're not going to be able to get them posted where we currently sit. So that's not going to be it's not a solution. It hasn't been a solution. I've been here almost 3 years now and I've watched that. Thank you. I think the only solution going forward, the viable one, is to go with Centurion, who's at least offering to help us financially restructure. And that would allow these jobs that people are talking about. And I think that that's working together with local leadership. So I'm not sure what detail folks are looking for on the phone or in the meeting personally, but I think that would be coming with a combination of Centurion and local leadership to start putting those goals together, but the sale has to go through first. Thank you.
Thank you. Anyone else interested in providing additional public comment today? Virtually, please raise your virtual hands, or in person, please approach the microphone. Hearing no one and seeing no raised hands, we are scheduled to hear public comments through 6 o'clock. So the Attorney General and RIDOH representatives will remain here through 6. We'll hold it open until 6 p.m. should anyone still plan to join. I know we only have a few more minutes. While this doesn't conclude our meeting at this time, I invite you to stay to hear any additional public comments for those who may arrive. Please know that your comments have been made part of the public record. And for those who are choosing to leave our meeting, I would like to thank you for participating today, and I hope you have the rest of a good night. Excuse me. Just last call here. Is there anyone else in attendance that would like to provide public comments but has not had that opportunity? Hearing no one. This concludes our public meeting. The Centurion Foundation Inc.'s hospital conversions application for the proposed acquisition of Roger Williams and Our Lady of Fatima hospitals. Thank you for your participation. Good night.